welcome to this AMA with me. I am Dr. Amanda Morelli. I am speaking today all about pain. I'm here to answer any questions that you might have about pain or any pain conditions that you are experiencing. So we have the live chat open, and that's where you can ask me any questions. We are also recording this. That way everybody can come back and watch it later. And I will be asking questions and answering them as well. Some questions that we've had submitted, I'll be answering those. So if you don't have any questions, you can always just stay and listen. So a little bit about myself. I mentioned my name is Dr. Amanda Morelli. I have a focus on pain at the AXOA Center in Toronto, and that's what the main type of conditions that I see there. So that can range from anything like arthritis, migraines, different types of headaches, joint pain, IBS pain, period pain as well. So many different types of pain that we can experience in our daily lives. And I work with patients to help them overcome their pain and make ways to help manage and enjoy their lives and live pain-free. So if anybody has any questions, we will leave the chat open. Feel free to ask anything in there and I will do my best to answer it. I just want to let everybody know that the questions and the answers that I provide are for educational purposes. So everything here is not considered medical advice. It's all for education purposes only. Okay. So let's see from the list of questions that we were provided, but I can ask. How can I stay positive and motivated when living with chronic pain? And what can I do to maintain a sense of hope and well-being? So yes, it can be very stressful to live with when you're in pain, chronic pain. You can't do the things that you want to do. Maybe you can't be as active as you want to be, or you can't do things around the house. If you have kids, maybe you can't pick up your kids and play with them. So it can be very stressful and it can be very down, like it can make you feel down, can impact our mood. So it's a great question about how can you stay positive and motivated and still have a sense of hope and well-being. So what I would say is always trying your best to live and do what you can within your boundaries. So try not to push yourself too hard. We tend to sometimes be a little bit ambitious and want to do a bit more than maybe we can do. So whether that be, if you need to ask somebody else that you live with for help out with doing things, or if you just need to take things in phases. So one great technique that's helpful with conditions like fibromyalgia or chronic fatigue syndrome is pacing. So basically you do things in increments of maybe 10 to 15 minutes and then give yourself a break in between for about another 10, 15 minutes. And this can depend on, your activity level or the way that you are, what you want to make your pacing time as. But let's say, for example, you have some activities to do around the house. You'd want to try to pace them and doing them in sections rather than doing them all at once. And I think this happens a lot of time when we have chronic pain or we have, fatigue and those types of issues. We want to do everything at once, get it over with, and then be able to move on to doing something next. Or we'll say, okay, I'm going to just finish everything and then I can relax. But it's actually better if we take things in stages. So that's one way you can stay positive and motivated if you're living with chronic pain, is giving yourself time to do things and taking things in stages. That way you'll feel better later and you won't be as maybe tired, or you won't be as in much pain, and then you'll be able to be a little bit more positive or motivated to do something else. So that's one tip, would be pacing things out. Let's see what other questions we have. At what point should I try to, yeah, so that's another good question. And I would say, it's better to do something sooner rather than later. We tend to sometimes put off pain or put off our appointments for a while. Let's say, you're experiencing some pain, maybe you'll be living it with already for a few months. And this is just what I see in practice, unless it's an instant injury, like a sports injury or a car accident. If we have just general aches and pain, we tend to let it go on for a few months before we seek care. So I would say sooner than later is better. And it's always great to get another opinion. Sometimes we might just maybe see one person before getting access to seeing many other people. For certain pain clinics, pain specialists, you might also need a referral. So just keeping that in mind, you'd probably want to seek it out sooner than later. That way you can maybe even you might have to be on a wait list or something like that. So I would say if you are experiencing pain, if you've been experiencing it for a few months or so, it doesn't hurt to try to access that kind of care. All right. See what else we got. Can chronic pain be a sign of a more serious underlying condition? So yes, definitely can be. It depends. Depends on where you're experiencing the pain, how long you've been experiencing it for. It's always great to get things assessed. Imaging is great to find out if there is an underlying condition. Sometimes pain can be due to autoimmune conditions, so something like rheumatoid arthritis. That would definitely be a more of an underlying condition. So having that assessed through blood work, that's something I always love doing in clinic, is checking some blood work markers to see if there is any underlying conditions. Checking even things like vitamin and nutrient deficiency can cause pain and fatigue. So checking some of those, and then getting the referral to do some imaging, whether that be, an X-ray, an ultrasound, MRI, to see what's going on. In terms of this varies for so many things, but let's say, for example, for gut pain or stomach pain, if you're having that kind of pain, it can be something minor. Maybe it was something you ate, or maybe you have a slight imbalance in your bacteria, or it can be something a little bit more serious, like an irritable bowel disease, where you have a lot of inflammation, and that's an autoimmune condition, and then that can cause pain. Or in terms of something like period pain, it is common and it is usual to get some period pain to some degree. If you have really severe period pain, that can be a sign of another underlying condition, something like endometriosis or something like fibroids. And those things, again, would need to be assessed with blood work, with imaging, and diagnosing what's going on. So that's a great question. It definitely can be a sign of an underlying condition. Not always, sometimes it is, but that's definitely why you'll want to get things looked at to see if it is something minor or something more chronic. All right. See what else we have. So are there any medications or other treatments that can help reduce my chronic pain? So yes, there are both medications and treatments. So on the medication side of things, I'm not going to talk too much about that because that's not my area of focus, but most people know there's things like over-the-counter medications, you've got Advil, Tylenol. Those things will be providing some temporary relief, some inflammatory relief. But then in terms of treatments, so things that I would do or things that we would do at Aches Away would be things like vitamins, supplements, and minerals, assessing any levels of that. Herbs are great for helping with reducing inflammation, reducing joint pain, period pain, migraines. So herbs are really, really helpful and wonderful. And then we have manual therapies, which would be things like massage therapy or osteopathy. Those are two other areas that can also help with chronic pain. So generally, when looking at a pain case, we're looking at providing a variety of treatment. It's never just going to be a one thing. We're trying to get a holistic approach here. So we would focus on looking at your diet. How can we put things in the diet that are going to help reducing some inflammation? How can we look at if there's anything that's maybe hindering your healing process? Is there perhaps too much sugar that's maybe preventing your body muscles and ligaments from healing? So that would be one aspect. Then we would look at herbs. Are there any herbs that are indicated for your case? Are there any vitamins and supplements and minerals? There's things like collagen. How can that help with healing the joints? Vitamin D is great for helping to modulate and improve the immune system to help the body recover. And then, like I was saying, the manual therapies. So we really want to look at a variety of things when taking on a pain case. Okay, let's see what else. So one question here is, I feel pain. What foods or food chemicals are most likely to cause pain for some, and why? So that's a great question. And I think this does vary from case to case. And some people might be more sensitive to certain foods than other people. So assessing by doing like a diet tracker and tracking when you're experiencing pain, the types of foods that you're eating to see if we can notice any patterns. But in general, sugar and in an excess amount, and this is sugar in the form of chocolate, sweets, and anything that's really baked goods with a lot of sugar, not the sugars that we would get from fruits or vegetables, but too much sugar can increase pain in the body, or it can impact your body's ability to heal, and that can be due to the inflammation that it can cause. In terms of food chemicals, there's nothing that really would stand out in one on its own, but it would just be an accumulation. So if you were getting a lot of pesticides or a lot of fillers or additives, you just want to minimize the amount of that you would consume. It's hard to completely avoid these kind of things. So we just want to be able to minimize the amount of those types of things that we would consume. So that way our bodies are able to heal. What else do we got? There's a question about how can you cope with the pain when having an IBS flare-up? So that's a great question. So definitely IBS flare-ups can be painful, uncomfortable, and for everybody can mean different things. Some people can have just a lot of bloating, can have tenderness, can have diarrhea, or some people might have, on the other hand, constipation. So with this, one thing we'd want to look at is having foods in the diet that will help be easy to digest and kind of calm and soothe things down. So when you are having a flare-up, you'd want to have things like that are easy to digest, which would be things like rice. So white rice is great. Plain chicken breast or chicken soup is another good one. You can cook apples and on the stove, so they're broken down and softer. So that's another great thing to have. It has a lot of fiber. So we want to have things that are just soft and gentle, easy to digest. It doesn't have many spices. Don't put too many spices, and then you'd want to avoid things like alcohol, coffee. Those kind of things would cause more irritation to a flare-up. Okay, then there's another question in the chat. This one is, what is a typical experience working with a naturopath look like? Yeah, that's a great question. So generally, we can start off two ways. One way is having a complimentary discovery call. And in that visit, it gives us a chance to get to know each other and for you to ask any questions. Tell me a little bit about what you're looking for, what your goals are, and see if we're a great fit. That's a nice way. Some people like starting off with that if they have any particular questions that they'd want to ask before getting started. So that can be the first step, or we can go directly into doing an initial. So that would be either the second step or the first step if somebody didn't want to do a complimentary. The initial is an hour long, and that is where we get in detail about health history. So if we're talking about pain, we would talk about, when did the pain start? Was there an incident that started it? Where you're experiencing the pain? How bad the pain is? We'd go more into detail about the history of the pain. And then also, because we are looking at things holistically, we talk about other things as well. So we would talk about, what does stress look like in your life? Or what is your sleep cycle like? What do you do on a day-to-day basis? What's your occupation? So we know, is there something in your life that maybe is triggering the pain or preventing you from healing? And then we'd, of course, talk about things like diet and digestion, seeing where everything's at with that. That can include, what you're eating every day, what your water intake is like. And that's what we'll get through in the first visit. And then towards the end of the visit is when we'll start talking about a plan, because I can do blood work testing and other comprehensive testing. We'll talk about that. If there's any tests that we would want to run that can help in, get to the underlying cause of what's going on. And then usually what we'll start off with one or two things to get started with. And then that ends the first visit. The second visit, after the first visit, is when I'll kind of take everything together, what we talked about in the first visit. And if we do any blood work, I'll review those results and then create a treatment plan that we will then start in the second visit and go over that. So that treatment plan will consist of a variety of things like we discussed already: diets, herbs, lifestyle habits. And then we take things in phases, and throughout the treatments, over the course of the treatments, we'll assess things in phases depending on what the needs are. So if somebody really needs to target inflammation first, we'll go with that. If somebody needs to more target, let's say, liver health, we'll do that first and follow up at subsequent visits, make adjustments to the treatment plan as needed. So, yeah. So I hope that clears things up. Okay. Do you have any success stories that you can share? Yeah, I can talk about one patient that I had that was experiencing migraine type headaches, and they kind of just, onset, maybe it was about a year ago. She wasn't really sure what started it. She was sick one time, and then kind of the headache kind of just never went away. And what we were working on, we did some testing. So just did some baseline testing to see if there's any sort of imbalances. We noticed that there was some low iron. So we started working on that. And then we started implementing some herbs and therapies to help with clearing out sinus congestion, because that's where they were getting majority of their headaches, in the sinus and frontal area. So by doing that, and then also we ended up doing a stool test because there was a lot of gut issues going on as well. By doing that, we noticed that there was some sensitivities in the gut and some gut imbalances in the microbiome. So by working on improving the microbiome, reducing some inflammation in the sinuses, and improving the iron levels, they were able to decrease the frequency and the intensity of their headaches. And we're still, this is a fairly new case, so we're still working on helping with long-term management, but they've improved so much just from making a few changes. Okay. Have you worked with athletes and runners to help them return from injury? That's great. Yes, I have worked with athletes and runners, and I like working with this group a lot because I myself, growing up, was a soccer player, an avid soccer player, and I would get a lot of injuries. So I know the frustration when you get injured and you can't play. So I feel like I really am able to empathize with those patients and athletes that have injuries. So with that, we definitely want to work on helping with recovery, helping with keeping, the mobility in the joints. Generally with these types of patients, they'll also be seeing somebody to do some physical therapy as well, which is really helpful to get that side of things. And then we'll work on how can we add things to the diet to help improve their recovery and the speed of their healing as well. Supplements, herbs, and then just things that they can take to help prevent that in the future as well. Okay. So I'll just leave the chat for a little bit, for a couple more minutes, if we have any other questions. But I think so far everything has been really good. We got a good variety of things. We've talked about, like, chronic pain, talked about the emotional side of things and quality of life, talked a little bit about gut and period pain, what the experience would look like, and then even athletes and athletic and running pain. So it's great. Okay. All right. So what we got here is a QR code. If you have a look here, this is where you can scan this code, book a consult with me, where I mentioned that 15-minute consult where we can discuss what your goals are, if you want to see if we're a good fit, and any questions that you might have to ask me before we get started with an initial. So I just wanted to thank everyone for coming out, and I hope you found some helpful information from this.